The lighting is so bad today, guys. I just look like a spot on the screen, so I'm not going to have the camera on. In order for you to see me, I have to literally move. The light is coming in. How y'all doing today?
Doing good. How are you?
I'm well, thank you. Wait, is the PowerPoint not showing? Do y'all see the PowerPoint or just me?
No, I see the PowerPoint.
Oh, good. Okay.
Chapter
Well,
7.
hello. Hello, everyone. I am Katina Flagg. I will be facilitating tonight's lecture. This is actually a time for you all. If you have questions, if you need answers to anything, just let me know. Uh, if y'all have a burn about homework assignments, something that you're not understanding, right now is a great opportunity for you to ask those questions. If not, I do have a lecture prepared to walk through, but it is encouraged to be interactive so that you get the best of your time. We do host 2 of these sessions during the course of the term. So this is the first one, and then the second one you will get that notice as well. Before I get started, does anyone have questions for me? If not, I will go ahead and turn the camera off and get back to the screen. All right, so this week you all are looking at chapter 7, right? Healthcare systems performance. So with this, you do have your discussion post and your assignments for this week. If you think of any questions, I'm here to answer those for you. But when we look at the performance of the healthcare system, we're looking at a holistic approach, right? So how well are things functioning? Satisfactory performance is crucial to healthcare organizations and to the healthcare system as a whole. And you may be saying, well, yeah, you think so, but why? The basis of the confidence in the systems needed for individuals and institutions to survive are very important. So you have a lot of key stakeholders involved. You have, your IT stakeholders, you have your clinical stakeholders, you have every different type of personnel in the organization that must work collectively behind the scenes to produce, positive outcomes. You have your compliance team. So all of those things need to be put in place. You have any questions about that? Okay. So we have different reporting methodologies. Hold on, someone is there. We have in hospital organizations, there are meetings of the minds to make sure that compliance metrics, hospital performance, meaning from revenue cycle, from patient care, from the administration of meds, all of those things are critical elements in performance outcomes. So when you look at the widespread of, the the electronic systems that are being put in place, how these systems communicate with one another. When vendor products are purchased, so most of you may work in a hospital setting. You all may have Epic as your primary healthcare, as your primary record. That is like the brain, the wheelhouse of your organization. But in addition to that, you may have radiology, right? They have different systems and technologies. You have your cardiovascular system, you have your endoscopic system. So each of those, and that's just some examples, you have your revenue cycle, you have your ED. So for all of those areas within the organization to function properly, they may have a vendor product that they use to make their work more robust, right? Um, So those are things that are taken into consideration as well. When you're looking at that healthcare system performance, how do these systems interface with one another? How is the organization working collectively to ensure that all of the information is confidential and is sound? As you all may know, not even only in healthcare, but in the airlines, there are always ransomware. Here recently, there was a big breach within the revenue cycle within hospital organizations. And then again, in the airport system, there was another ransomware. So this is some of the things that, are looked at when you're talking about um, hospital system performance. Does that make sense to everyone? And if you're typing in the chat box, I'm only on one screen. So you may want to unmute your mics if you have something to say. I see someone typing in the chat box right now. If you have anything you want to add, just go ahead and unmute your mics. So here it points out it's essential for healthcare professionals to understand the assessment process. First, healthcare professionals increasingly contribute in big or small ways to the process of assessing and improving system performance. So that's what I gave you an example earlier of the collaborative approach, how all these various stakeholders are working together to make sure that the end in mind is met. Secondly, they are greatly affected by the results of assessing the healthcare system. So whether it's providing direct care to the patients as a nurse, a therapist, a physician, or other clinician, or contributing to management of the healthcare organization, be it a hospital, nursing home, clinic, or other, their careers will be influenced by the assessment process. So in addition to the organization putting policies and procedures in place, we also have, regulatory bodies that will come into these organizations like the Centers for Medicare and Medicaid Services, the Joint Commission, DMV, when it's cardiovascular survey time, the specialists in that area, when it's a time for an ED survey, they have all of these surveyors come in to ensure that the hospital organizations are providing top tier services. And then on top of that, they have a metric score of how these organizations are performing that are placed out there on the CMS website, right? So over time, the insights gained from evaluating the health system's performance drive change in professional roles, practices, and training. So think about it, but many years ago, you didn't hear as much about so much hand hygiene. You didn't hear as much about reducing infections, right? So because studies have shown through all of the research and working collectively together, if they wash their hands adequately between patients, use the gloves, use the proper PPE, you can reduce infections, right? Okay. Um, Now in hospitals, they have robotic surgeries. So they have different procedures with those robotic surgeries. And why? Because the reducing of the infection post surgeries are a lot less if they go through a robotic procedure versus cutting the patient open, right? So those are some of the benefits of healthcare system performance. So when you look at the healthcare system performance, it's a global concept. It's not um, a single product or a single area that's being reviewed. It is a holistic approach. Does that make sense to everyone? Does anyone have any comments, questions, or concerns they want to add?
No, that makes sense. Thank you.
Thank you. So there are three evaluation criteria in the healthcare system. You look at quality, equity, and efficiency. So I'm sure, how many of you are already working in a hospital? So several of you are, right? But a physician office. Okay. So what you notice is you have your survey periods, right? Thank you for participating. Your survey periods. And you hear a lot of emphasis on quality. You may hear when you're in a hospital or a nursing home, they look at when the patients come in from a nursing home perspective, right? They evaluate the patient when they come in to check on bed sores. How many bed sores do they have? If they don't have any, perfect. But then while the patient is in the nursing home facility, some of the quality metrics, excuse me, measuring the treatment provided is if they had bed sores, why before they got there, or if they were acquired, right? If they are acquired, while the patient is in-house, in the hospital, or in a nursing home, any type of rehab facility, then any additional treatment required for those bed sores are not covered under Medicare, Medicaid, CMS reimbursement methodologies, because that's one of the quality metrics. You need to move the patient. You need to turn the patient. You need to make sure that the patient, isn't staying in that position too long to break down the skin. So those are some of the metrics that they use for performance outcomes. Does that make sense to everyone? Okay, efficiency. You know, how well are you guys checking the patients in? What's their wait time in the lobby? You know, how many steps are they taking from appointment to appointment? Those are some of the things when they look at efficiency and the equity. What is the value of performing these particular procedures? you know so those are some of the things that are evaluated when you look at the holistic approach, when you're looking at quality, when you're looking at equity, when you're looking at efficiency. How much is it costing us? How fast are we able to do it? How fast are we able to get this patient well? How can we reduce the length of stay? Those are some of the things. How can we get these patients in and out of here without having an infection? That those are metrics that are taken into consideration. So when we look at the micro level, and then you have the macro level. So the micro level is looking at the system performance, based on organizations including hospitals, physician practices, long-term care facilities, and other healthcare settings. So we just kind of gave some examples of that: the nursing home, the hospital, ambulatory treatment facilities, physician offices, and then we look at the macro, which is a larger scope. You're looking at your regions, your states, your nations, and other large populations or groups. So those are some of the ranges. So it's not just always limited to the scope of the facility where you're actually employed or where you look to become employed, but it's a holistic approach. Remember, we're talking about compliance, regulatory requirements, right? So at the macro level, performance assessments is conducted with identifiable healthcare providers, organizations, and treatments. For example, the quality of care in an ambulatory surgery center as indicated by the rate of post-surgical complications among cataract patients. So if you're going to go to facility A, you want to look at how well they're treating their patients. What's the recovery? What what type of infections, what type of complications are they having? Were there any demise post-surgical procedures? Many years ago, when I worked in a medical center, there was a facility for that would perform bariatric surgeries. And as we all know, bariatric surgeries for morbidly obese patients carry a significant risk, right? Well, this place had a lot of demise. Well, was it because of the type of patients, the patient population, or was it due to provider provider performance? So those are some of the things that they look at when it comes to quality of care. Well, there actually had, there was some concerns there, and that hospital was put on a performance improvement plan through the Office of Inspector General. So there are governing bodies looking to ensure patient safety metrics, that the hospitals are doing the best job that they could do for these patients. When they look at healthcare efficiency in the ambulatory surgical center, as indicated by medical care costs and resources used for that cataract surgery. So you see how you look at the quality, what's happening when the patients come out. Are they having a lot of complications? When you look at the efficiency, how much is it costing to perform those procedures? And then when you look at the equity of care, indicated for those post-surgical complications in cataract patients with private health insurance compared to those with Medicaid. Are they treating these patients the same? You should not be because I can afford health care versus me being on governmental health care that I get treated any differently. We should all get treated the same. Does that make sense to everyone? Somebody has their hand raised? You
That
can,
was that was me. I'm sorry. Yeah, I was just gonna say that was something that I found very shocking. I think it was a video that I watched that talked about race, like placism in the medical field or
mhm.
whatnot. It was that was very, very shocking to me that that is what I guess it should have been something that, is kind of, I want to say common sense, but that's not common sense to me, or something that should have been, you know, kind of expected maybe. But I didn't realize how big the problem was, how big placism really was in the medical industry, and how, the use of just simple things like your address, when you give that to the doctor's office, how that can affect your outcome, your treatment outcome.
And it shouldn't, but it depends on where you're going. You're right. It is. And let me just say, early on in my career, I saw someone type it in the chat box. Go ahead and continue your comment, and I'll read it in, or either you can unmute your mic. But there was providers that they would see third party payers, meaning non-Medicare, non-governmental health plan patients, right? And they would have their um, primary care plans through third party payers like Blue Cross Blue Shield, Cigna, and Humana. I'm just going to say for an example. They would have these patients come on Monday, Wednesday, Friday. Then they would have their patients that you would say were governmental payers, because they wanted that revenue from those governmental payers because it comes automatically, right? Based on the patient population or whatever their contractual agreements are. They will put those patients on Monday, I mean, just say Tuesday, Thursday, right? And on those, they would overbook those days where those patients would be like sitting in the lobbies, their wait times would be longer. They would have so many patients booked, but the patients that were getting paid by traditional payers, Blue Cross Blue Shield, they would give them the proper time to see them in between patients and not have them overbooked. So it depends. I mean, it's gotten better because of metrics and these type of performance measures. But yes, you would see various things happen and you would see disparities in patient care. Well, that's not what Medicare or any other payer design. That's not the design. Every patient should be treated equally, you know? So I have not been in the doctor's office for a very long time, but or help, those hospital organizations where you could see that patient flow. But when you look at patient flow, studies have been shown, and patients were complaining about their wait times, and so those type of doctors stop getting as many patients. But another thing that they will also do is not charge copays in order to drive up those patients. So some of those patients that did not have money, if they had a copay or something like that for their office visit, they would go because and they will wait that extra time because they didn't have the money to offset. So you saw different behavioral practices, and it's not fair, and you should not be treated differently because you could be a millionaire. You could choose to live in a zip code with, um, lower to lower class with, populations, and that could just be by choice. So you should not treat people differently based on a zip code or an address or even how they come in. I remember from the Walmart guy. He was a billionaire. You guys know when he passed away, he was like one of the richest individuals. But when I did research when I was in school, that gentleman never moved out of his original home. So he was a multimillionaire, and if where he lived was like a poverty area, who would have known? But because they knew his name, he would have gotten treated differently. But if you just looked at his address, who would have ever known that, right? He never moved out of his first home, no matter how much money he made. So, patients should be treated fairly, no matter, regardless. That's just, you know, how it should go. But people aren't always like that. When we look at the macro level of regions, states, and nations, many healthcare providers and organizations are assessed um, globally, right? So the measures of healthcare outcomes, such as life expectancy and mortality rates. Now, you will see the geometric length of stay. That's what they're looking at. Like, what are the outcomes? How are these patients being treated? How sick are they when they come in? How well did you maintain them? How soon did you get them out? Did they have to be readmitted within 30 days or readmitted within 72 hours? That readmission rate, all of those things are looked at when these hospitals are evaluated when it comes to the overall system performance. And I'm going to give this one example and then didn't realize we're almost out of time. So I can jump over to my next course. But here's an example. For example, how the healthcare system as a whole performs for seniors in a particular region. Basically, what you just said. The quality of care is indicated by chronic diseases, mortality rates for people over 65 in that particular region. This is how they start evaluating. And then if a particular hospital had too much, they will go in and do audits. Parents and family members can make complaints and go in and get those organizations evaluated if their family members aren't treated well. For me, when my mom was living, I was the one that would go to the hospital all the time. My godmother just passed. We just buried her last Sunday. I don't keep up with the days now. I'm so exhausted. But you have to have an advocate because if not, they may not see, some people still do not treat um patients the way they should, you know? So it's important for us to understand, not only because if you work in healthcare, but to be an advocate for your family, dig in, understand some of this content so you could be the one to make the difference for you and your family members. Thank you. Thank you so very much. Um, Before we sign off, does anyone have any questions, comments, or concerns? Or did you find any of this part helpful? And the one thing I'm going to tell you is I'm going to send you all a survey. I cannot find the UR code to give to you right now, but I will send a survey link out to you and ask you guys for feedback. For the live sessions, it's just a little simple survey. So I'll get that out to you. If not tonight, tomorrow, and then I'll also send the recording out as well. And thank you all for joining, and I will see you the next time. Thank you for those that engaged. Thank you, thank you. Yes, we'll get that the link out. It's a QR code, but for some reason I saved it somewhere and I cannot find it really quickly. I was looking for it earlier, but I'll get it to you. I promise I will. And see you next time. Thank you. Y'all have a good night. Thank you so very much. I appreciate the prayers.